Today I'll be talking about how you can prepare the perineum for childbirth. So this video is aimed to really serve those who are pregnant, especially those in their third trimester, just really wanting to learn how they can prepare their pelvic floor and their bodies for the birth experience. So I really hope you enjoy this video. It's gonna be a quick one, hopefully just to make it really nice and simple for you to understand. So the pelvic floor, I don't know if you guys knew this, but it has the capacity to stretch up to 250%. So muscles really do have the capacity to stretch and to lengthen. So being able to, kind of prepare for this and do exercises and techniques to soften the perineum, stretch the pelvic floor will only benefit you once the time comes. There can be many different types of tears that happen during childbirth. There's a first degree all the way to fourth degree. Now, there are techniques, again, that you can do that can help decrease the severity of the tears. So we really want to try to not have like third, fourth degree tears because those go all the way to the anal sphincter muscles. So the aim is to obviously have no tearing, but to minimize the severity of tears that you may have. So let's kind of understand how you can actually change the position of your body and your pelvis to create more space for the baby to exit out of the pelvic outlet. So I'm going to have you, if you're just sitting here, you're just going to sit down and place your hands, or you're going to cup your hands underneath your sits bones. So those sits bones are those two bones at the bottom of your pelvis that are meant to sit on. So they are marked in red in the photo on the right. And I'm going to have you do a series of motions that will actually change what happens to your sits bones so you can understand how you can position your body most optimally to make the birthing process easier. So again, you're just going to cup your sits bones with your hands. Now I want you to lean forward. Now, when you lean forward, you notice that it kind of opens up your sits bones. Versus if you lean back, your sits bones kind of come together a little bit. So again, if you lean forward, things open up. If you lean backwards, things kind of close together. Now, the next thing I want you to do is to squat. So you're going to squat down and you're going to position your toes facing inwards. Now, as you squat down and bend forward, you'll notice that your sits bones start to expand and lengthen and widen. Again, that's great because it creates space for the baby to exit. Now, if you squat and your toes are pointed outwards so that your thighs are externally rotated, and then you squat, you notice that it causes your sits bones to kind of knit together or come closer together. So just by doing these very simple movements, I can show you that, again, you can change what position you're in to just really help you. So we're going to next talk about the pelvic inlet and outlet and mid-pelvis. So there are three different areas of your pelvis that the baby has to go through. So you have the inlet at the top, the mid-pelvis, which is in the middle, and then the outlet. So there are, different exercises and positions you can put your body in to kind of optimize the space for your inlet, optimize space for the mid-pelvis, and then the outlet. Now, the only firm bony surface that the baby has to get into contact during labor, besides the cervix, is the pelvic diaphragm. And the pelvic diaphragm is the deepest layer of the pelvic floor, and it must be able to act like a trampoline. Because as the baby is descending into the mid-pelvis, you want those muscles to be supple, mobile. It needs to be able to lengthen. So there are different things that you can do to optimize the functionality of that pelvic diaphragm. So again, the pelvic diaphragm is located in the mid-pelvis. So again, pelvic inlet is the top, the mid-pelvis is obviously in the middle, and then the outlet is at the bottom. So again, another photo of the inlet being in yellow, the mid-pelvis in green, and then the outlet in blue. And you can actually ask your doctor, where's your baby? And they'll probably do like a cervical check, and they can give you some information about where the baby is. And that will give you guidance on, what positions you should try and be in to really help progress labor. So another just fun facts or just facts about the delivery process is that the babies are always in a constant state of flexion. So as the baby is descending into the pelvis, it will press on your sacrum and it will tell the tailbone to move out of the way. So this is why it's really important that you choose the best optimal delivery position, because you want your sacrum and your tailbone to move out of the way so that the baby can easily exit out of the canal. All right, so when it comes to the pushing phase, there are different things you can think about in terms of your breathing to really help soften the perineum, to soften your pelvic floor muscles, and make sure that you decrease the severity of tearing that may happen. So when you're breathing, you don't want to be holding your breath. You want to be thinking about creating space in your pelvis. So as the baby is coming down and out, really think about softening those muscles, kind of gently exhale through your mouth, and imagine creating space, opening up a balloon in your perineum just to create more space for the baby to exit. Some things that you can do to kind of help prepare your pelvic floor muscles and the perineum to be nice and relaxed is perineal massage, which is discussed during the physical therapy sessions. You can also sit on a ball at your perineum to kind of just mobilize it. Intercourse, obviously, and then just like really releasing muscles on the outside. So releasing your glutes, your hip flexors, your inner thighs, because all those muscles attach to the pelvic floor. Another thing that you can do is, which we've kind of talked about before, is don't push unless you kind of feel like you have the urge to push. I think there's a tendency to constantly push, but really instead of thinking about pushing, thinking about just allowing space or creating some openness in your pelvis, and that will kind of decrease the stress on yourself to try to think, I have to push the baby out. Instead, think about the baby is in control, and I'm just going to create an environment that makes all my muscles relax and soften so that it's easy for the baby to exit out of my pelvis. So I hope that kind of helps. I just wanted to give a brief talk about just tears, what you can do to help soften your perineum, and just a very brief summary of the mid-pelvis, the inlet and outlet, and how you can actually position yourself optimally to help progress labor in the best way possible.